short instructional video in preparation for your upcoming Oscar. The main skills that will be assessed will be family-centered communication, physical assessment in the form of observations, safe medication administration, mental health, a risk assessment and screening, or a domestic violence screen. You will have 20 minutes to complete your tasks, and within each scenario there are 3 roles that you will be assigned to and rotate through. So as the student, you will have the opportunity to be the nurse, the patient in the bed, and the family member visiting by the bedside. Now let's have a short demo on what is expected of your performance. So our patient is Lauren Davies Kirkwood. She is a 29-year-old woman who's been admitted to the women's ward for pain management and consultation with O&G. Lauren has recently been diagnosed with endometriosis. She has had numerous ultrasounds this admission, and it appears that she may need surgical intervention this time. Lauren is ABCDE intact. All observations are between the flags. Her wife Natalie will be in to visit, which may help to lift Lauren's mood as she's been feeling a bit low recently. Hi Lauren, I'm Bailey. I'm your nurse looking after you today. Hi, I'm Bailey. I'm looking after Lauren today.
Hi, how you going?
Good, thank you.
That's
Good. We just want to double check your name against the paperwork, and then I'll come back and we'll do your obs. So could you just tell me your full name, please?
Yeah, Lauren Davies Kirkwood.
Beautiful. And when's your birthday?
1st of the 1st, 1990.
Wonderful. And I just want to check our MRN as well. So it's 6519. Perfect. Okay, so we're just going to do your observations to start, and then so I've just got to go get my equipment, and I'll be right back. Okay.
Thanks, Bailey.
All right, Lauren, so we're just going to do your observations. Is that okay?
Yes.
Yeah? All right. I'm just going to get you ready. So you're already sitting in a nice position. This is my blood pressure cuff. So I'm just going to pop this around your arm. It's going to get a little bit tight. And then we're going to let the air out, and then I'm going to do it again, and that time I'm going to listen to your blood pressure, okay? And I've also got this little machine, so you might have seen it before. This is one that just goes onto your finger, and this tells us all about your oxygen level, okay? So we'll start with your blood pressure. Okay, Lauren, so you've been admitted for pain management. How's your pain at the moment? On a scale of 0 to 10. So 0 being no pain, and 10 being the worst pain imaginable, so like stepping on Lego.
About a 3.
About a 3, okay. And whereabouts is it, if you could point to the area?
Like in my stomach area.
Yeah, so across both sides of your lower belly?
Yeah.
Yeah. And how would you describe it, if you could put it into words?
It's pretty sharp pain.
Yeah.
It's just constant. It's always there.
Yeah. And would you like something for the pain? I can go check your medication chart and we'll see if there's something charted.
Yes.
Yeah.
Please.
Yeah. Okay. Cool. I'll go do that now. I'll be right back. Okay, so looking at my medication chart, I can see that it's Lauren's medication chart up here. I can see she's got no allergies. It's a legal order for her paracetamol that we're going to be giving. So there's the generic name printed there. We've got a date. We've got a route documented. We've got a dose. We've got a frequency, plus the times have been written in. And we've also got a signature, and there's also a name printed. So I know now that this order is good to go. So so part of dispensing medication is now I need to calculate exactly how many tablets I will be giving. Okay, so based on my calculation, I've calculated that I need 2 tablets to give the dose of 1 gram. So here we can see it's paracetamol, tablets of 500 milligrams, expiration date with its in date. We've looked at the medication, it looks all good. So now we're just going to check it definitely against the chart. Paracetamol, paracetamol, 1 gram, 500 milligrams, 2 tablets, and expiration date. So now dispensing it, so getting it out, we're going to use no touch technique. So that's my 2 tablets, putting it into my medication jar, my medication cup, and there, we're ready to go. So having a cup of water for Lauren as well, and we're all ready to go over to the bedside. Okay, Lauren, so we've got your Panadol here ready for you. I'm just going to do one more check. So we've got paracetamol, 1 gram, so right drug, right, it's oral, right dose, it's 1 gram, so we've got 2 tablets because it's 500 milligrams, right time, you haven't had it today, and right patient. So could you please tell me your full name?
Yeah, Lauren Davies Kirkwood.
Beautiful. When's your birthday?
1st of the 1st, 1990.
Good. And any allergies at all? No. Good. So I'm just going to check that the information here is the same as your name band. So we've got Lauren Davies Kirkwood, 1st of the 1st, 90, no allergies, and your MRN is 6519. Perfect. So we've got 2 tablets here for you to drink. Now, paracetamol can upset your tummy a little bit, so I'll just give you the nurse call bell and you can let me know if you have any funny feelings in your tummy after you have it. So we've got some water here as well. You're already sitting nice and upright, so you shouldn't have any issues with swallowing, and you're good to eat and drink as well. I checked your notes. So here's your 2 tablets and your water. I'll just stay here, make sure that you pop those in. How are you feeling today?
A bit down.
Yeah. What sort of, are you having any thoughts of self-harm or harm to others? No. Okay, so.
Just down. I just miss my son, and
yeah,
it's hard being a mum in here, and
yeah,
can't spend time with him, and he's on his own.
Okay. Would you like to talk to someone about that? Would you be happy for me to make a referral so that you can sit down and have a chat with someone about that? Yeah, okay. Well, that sounds good. All right. And then to conclude your Oscar, you'll be expected to provide a Isbar handover back to your assessor. So an example of this for the scenario that we just saw would go, so for an Isbar handover, I stands for identification. So I would begin by saying, hi, I'm Bailey. I'm the nurse that was looking after Lauren. S stands for situation. So Lauren is a 29-year-old who has been admitted for pain management and possible surgical intervention under the ONG team. B stands for background. So Lauren has a history of endometriosis and nil-known allergies. On assessment, so A stands for assessment. So Lauren's observations were between the flags, although she reported scoring her pain 3 out of 10. As she described it as sharp in nature and to her lower abdomen, generalized area. I gave her paracetamol 1 gram for this as charted and am awaiting effect. Lauren also reported feeling a bit down today due to this ongoing requirement of admission and issues around pain. So I've referred her onto our mental health team for assessment. R stands for recommendations. So I'd like you to follow up on the referral with the mental health team and also check in with her around the effectiveness of the paracetamol for analgesia.